So, we're just going to be talking to you guys today about how we can use internet-delivered cognitive behavioral therapy, or ICBT, to help manage pain and mental health amongst those with arthritis. And just to give you a bit of an outline, oops, I think I moved ahead too much. Sorry, just to give you an outline, first I'm going to start with just giving you guys a bit of a background on chronic pain and mental health currently amongst those with arthritis. And then I'm going to give you a little bit of background on what ICBT is and how we can use that to benefit those with arthritis. And so just to give you a little bit of background, chronic pain, as you've heard from a lot of the speakers today, is a big concern for those with arthritis. And not only does it impact you physically, but it also impacts other aspects of your lives, such as being able to enjoy daily activities. And so an example of this would be, maybe someone that used to go out for walks and participate in activities maybe have fear of doing that because they end up getting fatigued or having pain if they walk too much. And a lot of times what that results in is feeling isolated because they can't engage in some of those activities with their friends anymore. And because of that isolation, maybe they might feel symptoms of depression and anxiety. And so this is an important issue because those with arthritis have a higher rate of psychological distress compared to those without. And as we've seen before from the speakers earlier, that's a big concern also for chronic pain, because if you're feeling highly distressed, you're also going to experience that pain feeling even more worse. And so a lot of studies have shown that individuals that have both depression and anxiety and that chronic pain may have worse pain and other outcomes, such as even adhering to treatment. So for example, if perhaps a physiotherapist has asked you to complete some of your exercises or stretching, because of that fear of getting that injury or feeling pain, you might not engage in those activities. Instead, you might start avoiding those. And because you're avoiding those activities, you might not be able to improve some of those pain symptoms like you would be able to if you had addressed and engaged in those lifestyle changes. And so what happens is, what we're trying to do with the chronic pain and cognitive behavioral therapy is looking at pain from a different perspective and looking at it how we can improve it, your engagement with not only just everyday activities, but also other treatment options. And so today you've already heard about things like medical treatments with cannabis, and I think later on you're going to hear a little bit about lifestyle changes like perhaps exercise and diet. And if we think about chronic pain as a multifactorial system, all of those are different aspects of chronic pain that can be targeted. And what we're going to talk a little bit about is how we can target the psychological aspect of chronic pain. And so, as I mentioned, previous studies have shown that if you improve individuals' coping skills, you're able to also improve their ability to have manage their chronic pain and not feel distressed about or anxiety-related issues with that chronic pain, and improve their quality of life. And this is a big issue because one of the concerns is a lot of people may feel stigmatized with chronic pain, stigmatized with anxiety and mental health issues. So what can we do to improve it? And one of the biggest evidence base for managing these symptoms is related to cognitive behavioral therapy. And just to give you an idea of what cognitive behavioral therapy is, or CBT for short, CBT is the idea that if we look at thoughts, feelings, and behaviors are all interconnected. And so your thoughts influence your behaviors, which can influence your feelings. So an example of this is maybe if an individual is feeling depressed, they don't maybe engage in activities with other people, maybe they don't call their friends as often, and because they don't call their friends, they feel more isolated than they usually would, and then they, instead of going out with their friends, they don't have that behavioral aspect of meeting people, and it becomes this vicious cycle where they stay alone at home, they don't engage in activities, and then they start feeling isolated and depressed. And so with cognitive behavioral therapy, we try to target some of those thoughts and behaviors so that we can improve the individual's coping. And so CBT is a great option, but a lot of studies have shown that only 39% of individuals that have increased distress and severe pain actually engage in reaching out to mental health services amongst those with arthritis. And that's a big concern, because if you're not engaging with people that can help you, you're potentially deteriorating even further, and this is affecting your quality of life. And a lot of people, when we looked at why they're not engaging in mental health, is a lot of issues were things like stigma related to mental health or chronic pain, financial burden, because a lot of these services aren't covered, and then even travel issues, because some people with chronic pain and arthritis aren't able to sit in a car for too long and travel to some of these appointments. And so I think one way to overcome some of these issues is through iCBT, which is internet delivered CBT. And that helps eliminate some of those barriers that we faced, including saving therapists time, reducing wait list. It's not usually a financial burden. These are all free services. It also reduces stigma of having to go to see someone face-to-face. It's a little bit more anonymous than it would be when you were going to a face-to-face appointment. And a lot of the evidence, when we look at the arthritis studies, we did a recent systematic review, and what we did was we looked at all the studies out there that have looked at iCBT and its effect in arthritis. And what we found was that those that had chronic pain and arthritis and completed the iCBT had improvement in anxiety, depression, and pain severity. And that's really important, because not only are we targeting the mood, but we're also targeting some of those physical symptoms associated with chronic pain. And so our background is we're situated at the University of Regina, which is, and our unit is called the Online Therapy Unit. And a little bit of background on that unit, it was founded by Dr. Heather Hadjistavropoulos in 2010, and she's delivered programs like these to the general population for anxiety and depression here in Saskatchewan. And a lot of her funding comes from Sask Health, and so she's allowed to offer these services for free for anyone that's able to participate in them. And we've serviced over 4,000 people since the initial start of this program. 95% of people that have completed the programs say they would recommend it to others and felt that it was worth their time. They also said that it really helped them improve a lot of their symptoms related to pain and mental health. And so previously, we've looked at this in different populations, the general chronic pain population, as well as spinal cord injury, cancer, fibromyalgia. And we've learned a lot of things from those groups, and we keep hoping to improve our programs even further. And I think one of the things that we've noticed that I've mentioned previously is that there's a big change over time amongst those that take these programs in their symptoms of quality of life and anxiety. And then, sorry, I'm looking for slides. Okay, sorry. Sorry. Okay. Oh, there we go. Yay, slides. I'm just going to skip ahead a little to where I am. And this is our unit. Sorry. And as I was mentioning, there's lots of studies that we've done in other populations. And what we do is we ask people to complete online surveys through telephone screens. And then they get either referred to someone in the community based on their needs, or they get taken in, accepted into our programs. And our unit is consists of social workers and psychologists that are experienced in delivering these programs. It includes community therapists. So Sask Health has recently provided us with the funding to have a satellite campus that consists of community therapists to deliver these programs to individuals that have been accepted into the program. And as I mentioned, over time, we've noticed significant changes in depression and anxiety amongst those that have taken the program. One of the programs we've delivered is the chronic pain program, and we've seen improvements not only in disability, depression, anxiety, but also in pain avoidance, which is a really big issue for those with arthritis and chronic pain as well. And another program that was important for us was the spinal cord injury program because of their big concern with chronic pain there as well. And again, these individuals have shown significant improvement in pain and depression and anxiety, not just right after the treatment, but also continued at follow-up when we talk to them again at 3 months. And when we look at some of the secondary outcomes related to pain, we notice that we've been able to improve how they're engaging in activities and also in their mood. We weren't able to show significant improvement in sleep yet, and because of that and feedback from our patients in that group, we've been able to create a new module that helps to improve sleep and sleep hygiene. And in terms of quality of life, not only does it help build resilience and self-efficacy amongst those individuals, but also helps in increasing participation in community groups. So again, the idea is to be more holistic approach to managing chronic pain. We don't want to just help improve your pain and your mood, but we also want you to start engaging in those activities that you used to love before that pain was interfering. And some patient experiences that we've had, some feedback we've heard about is, a lot of the patients that come through really get help from, a lot of the emails that we get, the telephones that we provide. One of my concerns, because this was not my background, I've done a lot of face-to-face work, was can you still have a connection with a client when you're on the phone with them or when you're just emailing them? And we've noticed that that same therapeutic alliance is still there, even through telephone and email, as you would experience when it's face-to-face. And a lot of people have said, when they've completed this program, they just feel like they're more capable. They have more tools under their belt on how they can manage their pain. One of the biggest things they said they learned was the idea of overactivity versus underactivity. And I think many of you might kind of align with this, where many of us are very big go-getters, and what we'll do is, we feel great one day and we'll exercise like crazy, and then the next day we'll feel very tired and fatigued and kind of feel like, we shouldn't have done that and regret it. And so what we are able to help you is not just avoid the symptoms, but also engage in like a balanced, paced environment where you can engage in activities without going overboard, but at the same time not doing underactivity. And the other thing we learned from patients is they really start to appreciate their life in spite of their condition. Many individuals talk about, finding benefit in improving their symptoms. And even though they have a chronic illness, there's a lot of things that, have occurred, like maybe being closer to their family, finding that support that perhaps they thought they wouldn't have from their family members and they were nervous about. So those are some of the positive effects that we've noticed. And so based on those feedbacks, we've now created a new program that doesn't just target chronic pain, but it targets more of a holistic approach, and it's called the Chronic Conditions course, and it's transdiagnostic, which basically means it's for any individuals with a chronic health conditions. And so right now we're conducting a randomized control trial, and a lot of the evidence for this is based on guided support. And the problem with guided support is sometimes it can be burdensome, and maybe unlike us, who's being funded by the Saskatchewan Health Foundation, maybe other individuals don't have that option. And so what we want to see is self-directed, so without a therapist, just as effective as guided therapy. And so what we're doing is we're looking at a trial where you can be randomized either to the guided condition or the self-guided condition. And we want to recruit people from across Canada to see how we can improve their pain, their fatigue, and anxiety symptoms related to their illness. And so I'm just going to let Giuliano just speak to you guys a little bit about that program.
So when accessing our website, initially clients will go through a couple of screening processes. So they're originally going to have to go through a pre-screening questionnaire where they'll just fill out some basic information related to sort of a background of just very, as I said, basic information related to their symptoms of anxiety, depression, and or pain. And if they find themselves, or if they are eligible for the course, they'll then go through a more thorough telephone screening process where they'll be paired up with one of our service providers, and they'll just sort of get a little bit more of a deeper understanding of some of the symptoms related to the, push this up a little bit, sorry, related to they'll just get a little bit deeper into some of the background and history of the symptoms related to their condition. And sort of some of the issues surrounding why they're applying. So, there we go. Okay. So the course is divided into 5 separate lessons, which spans across 8 weeks. So the lessons will offer different skills for managing the symptoms, and it's self-directed for the most part. After pre-treatment, clients will be sequentially offered lessons 1 through 5, and of course a post-treatment questionnaire, which is going to follow that up, which just sort of throughout will be measuring their symptoms of anxiety, depression, and pain as well, and it's just to sort of get a chronological sequence of events, essentially, of how they're progressing, as well as offering the courses in time, or in the proper timing, so that they learn the skills and can build on previous skills that have been offered for them as well. So yeah, week 1 through 8, the courses, all 5 lessons will be offered for 8 weeks. Some lessons are a little bit more involved, and so clients will spend a little bit more time on some of the lessons. But they're divided in a way that sort of makes sense and allows the clients to learn skills that are going to help them manage and cope with their symptoms of anxiety, depression, and pain as well. And it's mostly, as I said, self-guided, but they will have contact with a guide to sort of help them through some of the issues that they're having, as well as to teach them some of the skills that they can use to manage their symptoms. So along with the lessons and the skills that are taught in the lessons, there are several do-it-yourself guides as well, which are sort of supplemental resources as well. But these are the more practical or applicable homework tools, essentially, for the course. So after going through the course and learning a little bit about what's involved and some of the skills, as I had said previously, these will sort of take what is learned inside the course and apply them to your daily life. So it'll have homework tools and suggestions and maybe some assignments that you will read through and incorporate those into your daily life. And in doing so, clients will essentially gather the necessary information to learn what's underlying the skills and how to then apply them into their daily lives. And along with the do-it-yourself guides and lessons, each lesson has a couple of stories integrated as well. And these are adapted stories from just from previous clients as well. And so we've adapted them as just to offer clients some insight into some maybe relatable situations or other people who've gone through similar situations. And they also are we use them as a method as well to maybe offer clients a way to read something that's relatable to them and to have other experiences from other real people who were going through the same issues as well. Our courses also offer some supplementary resources as well. So these aren't really mandatory, but they're just extras that the clients can use, and they go more in depth and they elaborate a little bit further on some of the skills that you're going to learn in the course. As examples like assertiveness and communication, they're essentially just more broad and more focused versions of the lesson, which if clients feel like they need to check those out, they're more than welcome to, but it depends on the client and your individual learning or work rates. So those are added to the course as well as a method for just extra information that you can check out. So as I said earlier, it's mostly self-directed, but our course is also guided. So once a week for around 20 minutes every week, a guide will be in contact with a client, with any clients or each and every client, to just go over some of the concerns and issues that they're having in the course, or to address any questions that clients may have about some of the things that they're learning, and to clarify some skills or clarify any of the skills or any of the information that's being learned in the course, as well as just to offer some motivation to the clients if they find that maybe they're not feeling as motivated to go through the work. The guides will be there once a week at least to check in, and that is all done over our secure messaging system on our website as well. So it's just a check-in once a week, and regardless of whether or not there are any issues or not, more often than not, there will be at least one check-in a week where the guides will be in contact with the clients. So similar to some of our previous courses that we offer and some of the other courses that we're currently offering as well, we hope to find that by going through this chronic condition course, that symptoms of depression, anxiety, fatigue, as well as pain will be reduced. And we hope that we'll also see an increase in self-efficacy and satisfaction with life and quality of life as well. And one thing that hasn't really been explored before that we are looking at, and was sort of alluded to previously by Swati, is we're looking at benefit finding for people with chronic conditions. So benefit finding consists of the positive experiences related to negative life events. So as is probably evident, having a chronic condition can be associated with many different negative stressors or negative things associated in life, whether that's pain, whether that's, as we said, symptoms of anxiety and depression earlier. But we also find, or at least there's growing evidence that is looking at some of the more positive aspects of life that people find specifically from and related to experiencing a negative life event. So in our case, this is a chronic condition. So probably as the best definition for it is by Riley, where it's the positive consequences of negative life events. So a lot of people find that they maybe are a little bit more in tune with their emotions from having experienced a chronic condition, or maybe they have developed stronger familial ties, or maybe they've found that they have more patience because of some of the experiences that they've had to go through due to their chronic condition. And full disclosure, I am working on that project. That is my project for school right now. So you can get involved if you would like. You can visit us at our website, onlinetherapyuser.ca, or you can email us at online.therapy.user@uregina.ca. And there's also, if you go on our website, there is the application process where you can, if you choose, if you'd like to join our course, we would love to have you. So I'd first of all like to very much acknowledge and thank the patients who go through our courses, and the clinical team as well, who are offering the service to the clients across Saskatchewan. Without either, we would not be able to do this. So thank you very much. And we'd also, of course, like to thank the research team, which I'm a part of, so thank me, no. As well as our community partners and the researchers over at Macquarie University who initially started the program, which we've adapted for use in Saskatchewan as well. Any questions? Thank you very much. Next one.
I was just wondering, and maybe I missed it while I was eating, but is there a discussion group component to any of these where you can discuss with other people taking the course how they're finding it? I just think that I know I've done face-to-face group chronic condition things, and often it's what other people say as much as what I'm learning. So I was just wondering if that was part of the component or something you would look at doing.
So currently we don't have one. Our website just doesn't have the capacity to have an encrypted discussion board, but it's something we're working on in our new website, which we're hoping to have done by next year. But I think that's a really important point because it really helps to have like peer support groups and even discuss, what people have used and how they've used some of the skills that they've learned. It's more important sometimes than learning from someone that maybe doesn't have that same condition. So thank you. Yep, and then we also have cards on all the tables, and I think it just gives you're welcome to take, and we have a bunch more, so we can hand those out. It just has all of our website information and email address. Thank you.
Thanks.